Womb cancer, also known as uterine cancer, refers to cancer that develops in the uterus, womb, an organ in the female reproductive system where a baby grows during pregnancy. The most common type of womb cancer is endometrial cancer, which begins in the lining of the uterus, the endometrium. Another, less common type is uterine sarcoma, which starts in the muscle layer, the myometrium, or other supporting tissues of the uterus. Types of uterine cancer. 1. Endometrial cancer. This is the most common form of uterine cancer, often associated with hormonal imbalances. Risk factors include obesity, estrogen therapy, diabetes, and not having children. 2. Uterine sarcoma. A rare type of cancer that arises from the muscle or connective tissue of the uterus. It may grow and spread more aggressively than endometrial cancer. Signs and symptoms. Abnormal vaginal bleeding, e.g., bleeding between periods, postmenopausal bleeding. Pelvic pain or pressure. Unusual vaginal discharge. Pain during intercourse. Difficulty urinating or pelvic discomfort in advanced stages. Risk factors. Several factors can increase the risk of developing womb cancer, including 1. Age. Most cases occur in women over 50, particularly postmenopausal women. 2. Hormonal imbalances. Excess estrogen without progesterone balance increases the risk. 3. Obesity. Fat tissue produces estrogen, which can lead to hormonal imbalances. 4. Diabetes, associated with increased cancer risk. 5. Genetics. Conditions like Lynch syndrome increase risk. 6. Reproductive history. Not having children or early menstruation and late menopause are risk factors. Diagnosis. Doctors use several methods to diagnose uterine cancer. 1. Pelvic examination, to feel for abnormalities. 2. Ultrasound. Transvaginal ultrasound can evaluate the uterus. 3. Endometrial biopsy. A sample of the uterine lining is tested for cancer cells. 4. Hysteroscopy. A small camera is inserted into the uterus to examine the lining. 5. Imaging tests. CT scans or MRIs may be used to assess the spread. Treatment options. The treatment depends on the type, stage, and grade of the cancer. 1. Surgery. The primary treatment, typically involving a hysterectomy, removal of the uterus. In some cases, the ovaries and fallopian tubes are also removed. 2. Radiation therapy, to target cancer cells and reduce recurrence risk. 3. Chemotherapy, used in advanced or aggressive cases. 4. Hormone therapy, for cancers sensitive to hormones, e.g., progesterone therapy. 5. Immunotherapy. In certain advanced cases, newer therapies may be considered. Prevention and early detection. Maintain a healthy weight. Obesity is a major risk factor. Balanced hormone therapy. Women on estrogen therapy should also take progesterone. Regular check UPS. Early detection of abnormal bleeding or other symptoms can lead to timely diagnosis. Know your family history. Genetic counseling may be beneficial if you have a family history of cancer. If detected early, uterine cancer is often curable. However, advanced stages may require more extensive treatment. Regular health checkups and awareness of symptoms are crucial for early diagnosis and successful treatment.